Hello friends, welcome back to my YouTube channel. Hope so all of you are doing great. This is the third video of our series of vital signs. I have provided the link of other videos of this series down in the description. You can watch the video direct from the link. Today's video is on the second vital sign, which is pulse. So, without assessing the artery, let's start the video. We are going to start this video from the definition of the pulse. Pulse is defined as the wave of blood created by the contraction of the left ventricle of the heart. These waves of the blood are created in the arteries. In general, the pulse wave represents the stroke volume output or the amount of blood that enters the arteries with each ventricular contraction. The unit in which pulse is expressed is beats per minute. There are over 9 sites from which pulse is accessed. These sites are temporal, carotid, apical, brachial, radial, femoral, popliteal, posterior tibial, and dorsalis pedis. A good pulse has 3 general characteristics in it. These characteristics are pulse rate, pulse rhythm, and pulse volume. Pulse rate is the number of waves created by the heart in a minute. Pulse rhythm is the pattern of the beats and the intervals between the beats. Equal time elapses between the beats of a normal pulse. Pulse volume. Pulse volume, also known as pulse strength or pulse amplitude. Pulse volume refers to the force of blood with each beat. Usually, the pulse volume is the same with each beat. It can range from absent to bounding. Alterations in the pulse. Alterations in the pulse according to rate are tachycardia, bradycardia, dysrhythmia or arrhythmia. Tachycardia is defined as an excessively fast heart rate, which is over 100 beats per minute in an adult. On the other hand, bradycardia is defined as the excessively slow heart rate, which is less than 60 beats per minute in an adult. Dysrhythmia or arrhythmia can be defined as a pulse with an irregular rhythm. This irregular rhythm may consist of random, irregular beats or predictable pattern of irregular beats. There are many factors that affect the normal rate of the pulse. These factors are age, sex, exercise, fever, medication, hypovolemia or dehydration, stress, position, and pathology. Age is inversely proportional to the rate of the pulse. As age increases, the average pulse rate gradually decreases. Sex or gender. After puberty, the average male's pulse rate is slightly lower than the female's pulse rate. Exercise or muscular activity. The pulse rate is directly proportional to the exercise. The pulse rate normally increases with the increase in activity of the body. Fever. In case of fever, the pulse rate increases due to the increase in metabolic rate. It is also increases due to the peripheral vasodilation, which is associated with the elevated body temperature. Medication. Some medications decreases the pulse rate and others increase it. For example, cardiotonics decreases the heart rate, whereas epinephrine increases the heart rate. Due to the increase or decrease in heart rate, pulse rate also increase or decrease. Hypovolemia or dehydration. Loss of fluid from the vascular system increases the pulse rate. To compensate the hypovolemia or dehydration, the heart rate increases to increase the blood pressure. In result, the pulse rate increases. Stress. In response to stress, sympathetic nervous system stimulates the overall activity of the heart. Stress increases the rate as well as the force of the heartbeat. Fear, anxiety, as well as acute pain stimulates the sympathetic nervous system. Position. When a client is sitting or standing, blood usually pools in a dependent blood vessels of the venous system. This pulling causes a subsequent reduction in the blood pressure and increase in the heart rate. This increase in heart rate results in increase in the pulse rate. Pathology. Certain diseases, such as some heart conditions or those that impair oxygenation, can alter the resting pulse rate. That's all for today, friends. Peace out.